Good afternoon. Welcome, everyone. My name is Allison Drew. I am the program coordinator for the Iowa Regional Autism Assistance Program. Welcome to the Autism Basics Webinar Series featuring Dr. Kelly Pelzel, and this session is on school programming. And I want to give a friendly reminder that certificates of attendance and foster parent training credit are available for the live sessions only. And now I'm happy to introduce Dr. Kelly Pelzel. Dr. Pelzel is a licensed psychologist and a clinical assistant professor working in the University of Iowa Stead Family Children's Hospital Child and Adolescent Psychiatry Division. She earned her BA from the University of Northern Iowa. Dr. Pelzel received her PhD from the University of Utah. She completed her predoctoral psychology internship at the Primary Children's Hospital in Salt Lake City. Dr. Pelzel completed a leadership education in neurodevelopmental and related disabilities postdoctoral fellowship at the University of Iowa Stead Family Children's Hospital Center for Disabilities and Development. She provides assessment and treatment services. Dr. Pelzel also serves as the clinical coordinator for the University of Iowa Stead Family Children's Hospital Autism Center and the psychology consultant for Iowa's Regional Autism Assistance Program. As we go through the session, questions can be typed into the Q&A box down below, and Dr. Pelzel will respond to them at the end of the session as time allows. And now I will turn it over to Dr. Kelly Pelzel.
Thanks, Allison. Appreciate that introduction again today. Well, we're on our fourth webinar in this webinar series, and our last for the fall here. And if you have any questions today about things in prior webinars, I'm happy to take those questions as well. Or if later on you think of questions or you want to just ask offline, feel free to reach out to me by email. I'll put my email address up again at the end of the presentation today. And overall, we're going to be talking about some special education terms and processes. We're going to be talking about things like educational goals and interventions and accommodations, including accommodations afforded through special education law, as well as those afforded through Americans with Disabilities Act. And we're going to be talking about some other educational resources that are out there for you. And as I mentioned, this is the last webinar in the fall series. And in addition to reaching out with questions, if you have thoughts on things you would like these webinars to include, things that maybe we didn't get to this time, they're always changing a little bit from semester to semester. And so let us know if you have an idea of something that would be helpful for us to include, something that you really liked or really didn't like about the webinar, where we love that kind of feedback as we think about revisions for webinars to come. The other thing I just wanted to mention before I get started on the material is that I'm a clinical psychologist, and that's slightly different training than what a school psychologist gets. So I, didn't do any, that's not exactly true. I did a little bit of practicum work in schools, but primarily worked through clinics as part of my graduate studies. And I haven't worked for any school districts or education agencies since graduate school. And so I come at things at a little bit different perspective, and I'm always learning and trying to keep up with what's going on in the schools. Last year, I had a postdoctoral fellow working with me who had just basically had a career change where she was coming out of the schools as a school psychologist. So that was super helpful for me to learn from her and get clarification on kind of current policies and procedures and that sort of thing. Okay. So we're going to be talking about both special education law and Americans with Disabilities Act, as I noted before. And as we're thinking about special education laws, we're specifically going to be delving into the different parts of the Individuals with Disabilities Education Act. And this is the federal legislation that dictates special education, K through 12, as well as early childhood special education, so programming during those preschool years. And part of it also lays out what they call Part C early intervention, or Part C 0 to 3 early intervention. And different states call this different things. Here in Iowa, we call that early access. So services for very young individuals. And a 504 plan is something that can be developed as an accommodation plan. And that is not under special education law, but rather under Americans with Disabilities ADA law. So the Individuals with Disabilities Education Act, IDEA, grants or guarantees, I should say, students with disabilities the right to a free and appropriate public education. Sometimes you see that abbreviated as FAPE, F-A-P-E, provided in the least restrictive environment, which sometimes you see abbreviated as LRE. So what this law broadly lays out is that parents can request assessment for their child to determine if their child needs some sort of specially designed instruction. And that evaluation determines if an educational disability exists. It does not make a medical diagnosis. Those are kind of two separate things, two separate pathways, two different sets of people involved. The evaluation team must include a specialist with experience with children with autism when they're evaluated. And even if kids already have a medical diagnosis, they still have to go through this evaluation through school programming or the AEA that has to be completed in order to determine if a child is eligible for special education for services under IDEA. So a diagnosis alone does not suffice for determining whether a child is eligible or not. Another thing I'll say about this, and maybe I have a slide on this later on, I'll just say it now, is that Iowa's a little bit different than most states. So most states, when they do classify whether a child is eligible or not for an IEP, they classify it in a category, or they put it into a category in terms of how they are, what type of disability the child has that's qualifying them for services. So you may see something like intellectual disability or brain injury or serious emotional disturbance. There's a kind of a category that's catch-all called other health impairment. And anyway, so kids are typically categorized in that way, and it's on like the front or maybe the second page of the IEP. But in Iowa, we're a non-categorical state, so we base the IEP on the child's needs, so those areas of deficits that are determined during the evaluation process, and they aren't qualified with a category in mind. Okay, so let's talk a little about early access and some terms that go with that. So again, this is Iowa's Part C, or 0 to 3 early assessment intervention service coordination program. It's federally mandated. It's part of special education law, and it's delivered free of cost to the family in a child's home. Sometimes in a daycare as well, if the child's at daycare, during daytime hours and such. Oftentimes the interventionists will go there to do intervention work. And rather than an IEP, we'll get to the IEPs here in a minute, the plan that's used that they follow is called the IFSP. Okay, so if a child qualifies for these early intervention services, this is the document that describes what they're working on in terms of the goals, as well as specifically what are the supports and services that are being provided while the child's receiving Part C services. Now it's called, 0 to 3, but a more accurate excuse me, way to think about it is birth up to 2 years, 11 months. Because once a child turns 3, then if they're going to be continued to be served under IDEA, it's going to switch over to early childhood special education. So it's really just the very young kids who are served through IFSPs. And how it works is in Iowa, our Part C early access is a partnership between several entities. Most of the services are provided by what are called area education agencies. I'll talk more about them in a second. But Department of Ed, Public Health, Human Services, and the Child Health Specialty Clinics are also involved with early access. So when we think about AEAs, area education agencies, basically you can think about this as a way for districts across Iowa, school districts and other entities to be able to pool resources. So, for older kids, each school district, especially the small ones, would really have a hard time, like each having a school psychologist employed by their district. So this is a way for multiple school districts to be served by one professional. If it's a large district, maybe they're just assigned to one district, but if it's a bunch of small ones, they're probably going between school districts to provide services. It's not just school psychology, it's speech pathology, occupational therapy, physical therapy, among many other specialists. And I would say also materials and resources as well. And currently, the state is divided into 9 AEA regions. So you can kind of see there on the map, and they aren't totally by county, as you can see. So they try to keep things kind of evened out and things. So you see some squiggly lines there. But these are the 9 AEAs currently in Iowa. So they do have a statewide toll-free number. So if a provider has concerns about a child and wants an evaluation to see if they're eligible for early access services, they can just call this toll free number. They can also fax or call into their local AEA if they know which AEA is going to be serving that child. And parents can call in as well. So it's not just providers, but parents can call in and self-refer if they have concerns about their child's development. And if the child qualifies for that early intervention, for someone to come out to the home and work with the child and work with the parent on some skill building things, an IFSP is written and services are started. Eligible children typically have some sort of health or physical condition that might affect their growth or development, or they are showing significant developmental delays in their ability to play, think, talk, or move. And again, just like for older kids, they do not need a medical diagnosis in order to receive services. So this can get started right away, even if someone's waiting for a specialty appointment to take a look at a child's development. And when the child gets a little bit older, so they're approaching 3 years old, the early access team is going to be thinking about where the child's at on their goals and to be thinking about whether it makes sense for the child to transition to early childhood special education programming. And if they are eligible for continued programming, there's lots of nice coordination between the early access team and the incoming early childhood special education team to make sure we're transferring information about what's working well with this child and child strengths and things that you want to focus on or be aware of as an incoming provider. Okay, so now we're going to switch up to early childhood special education. So this is for preschool age children, like starting at age 3, and it's provided by area education agencies and local school districts working together. One exception is Des Moines Public, which operates without AEA assistance. So when a child is 3 or older, rather than an IFSP, they have an IEP, an individualized education program is what that stands for. And this is that written plan that focuses on what those learning needs are of a specific child. Here's some components that it's required to have by law. Has to have goals on it, has to have documentation of current performance, has to have documentation of what supports and services are being given, and the modifications the school is required to provide to help children meet their goals. And finally, a way to measure progress on the goals. So a provider or school staff actually can refer a child for an evaluation with parental permission, of course, or a family can self-refer to be evaluated to see if their child would be eligible for early childhood special education services. And as I said before, some kids just kind of transition up to this from early access. Other kids meet their early access goals. They're on track developmentally, and services, cease and they don't go into early childhood. So the IEP is written if a child is qualified, and then the services are started. Oh, here's where we talk about non-categorical states. So again, children don't need a specific medical diagnosis to receive services, and there's no category of disability under which they're being served. I should have probably mentioned this. Another category in other states is educational autism, was the name of the category, but we don't have that in Iowa. Okay. And then thinking forward again, as kids get closer to that kindergarten year, the IEP team is going to be able to assist with the transition to kindergarten programming. Whether a child is going to stay on an IEP as part of special education programming, or discontinue if they've met their IEP goals and are doing okay developmentally. So special education are intervention services for children and young adults provided by EAs and local districts, local school districts up to age 21. And again, same as the early childhood, Des Moines Public operates without AEA assistance. It's still an IEP under which kids are being served, and the components of the IEP also remain the same as during the preschool years. So obviously the content's going to be a little bit different, but the pieces that they have to have in the IEP are the same. So again, once kids reach school age, a provider can or school staff can still refer a child for an evaluation, again with family permission, or a family can self-refer. And some children come up from the early childhood special education programming, so they continue on with their IEP from that. And if found eligible, the IEP is written or revised if it's coming up from early childhood and services are started. Same, we remain non-categorical for school-aged kids as well. One important thing to point out about IEPs for school-age kids is that we start thinking pretty young about transition planning in Iowa. So post-secondary transition planning starts at age 14 in Iowa. So this is a part of the IEP in which they're planning for transition from high school to learning, living, and or working in the community after high school. So federal law, so IDEA, mandates that this kind of planning has to start by age 16, but they actually get started a little bit sooner in Iowa with it. Okay, so now I've talked quite a bit about all these terms and processes. So I thought we'd take a little break to kind of see it all in action. So this is about individualized education plans here, and we'll just watch this video for a little bit here.
According to federal law, an individualized education plan, or IEP, must be created for each student who qualifies for special education services. Jennifer and Bernard are the parents of one such student, 9-year-old Sean.
Oh, sorry about that. Just trying to make sure it was loud enough.
As part of the IEP team, parents meet with teachers, specialists, and administrators to review Sean's educational plan. IEP teams meet at least once a year. Sean's teacher begins by reviewing his strengths.
In terms of where his sight word vocabulary is, we measured it recently at the 4th grade level. However, his word attack skills are, I would say, around the mid-second to early 3rd. So there is a year discrepancy. But comprehension is different. When text is read to him, we know that his strong cognitive skills have allowed him to progress at a normal rate in that area in understanding text.
Is he reading more at home? Do you see him trying to read more, or is it...
I started a book with him the other night. He did not want it at all, and I said, well, I'll just read the first chapter to you. And then he got so interested in it. It was a new book by James Marshall that he said, oh, read me another chapter, and I did. But then he said, oh, I want to read another chapter myself. So I thought, well, at least he can get started on something and get his interest in it a little bit.
Well, he still struggles, of course, because even though his sight vocabulary is at a certain level, and I think his comprehension is even beyond that, but if he doesn't know a word, he still doesn't have the strategies firmly enough so that he can read on his own. So I'm sure it's frustrating for him because he wants to really know what happens, but it's hard to take the time to break all these words down. So my guess is that he'd much prefer someone else to read it to him.
Yes. Oh, yes, definitely.
I'm finding that he's in Boy Scouts. And I have to read the handbook to him, and he prefers me to read it to him.
Sean's teacher moves on to discuss an area that needs improvement.
What we really needed to address at the beginning of the year was Sean's weak phonology. When he was presented with nonsense words like sizz and baz, Sean had a significant difficulty isolating each sound, blending them to formulate the nonsense word. So we had to go back to the drawing board in the area of phonology and review with him the consonant sounds and also build his vowel discrimination. And that's what we've been doing this year. And we've seen some nice improvement.
Specialists next report on Sean's latest assessments.
On here are individual numbers and letters. Some of them are reversed, and Sean had to find which ones were reversed and identify them, and that for him is not a problem. He missed more reversals whenever they were couched within a word.
There really is an obvious visual difficulty here in terms of discrimination, and probably within the text when there's a lot of words on a page, it's going to be a lot harder for him.
Sean's speech therapist offers her progress report.
What happens is when Sean says those sibilant sounds like CH, SH, J, and S, air escapes through the sides of his tongue, and it's not supposed to. And I think this is all, as Lisa was saying, he has low tone, his body, and that goes along with the muscles in his face and his tongue. So we're strengthening his tongue and his cheeks and all his oral motor muscles, which will lead to more clear speech.
This discussion will lead to a revised IEP, which will set new goals for Sean.
What we'd like is to see him write more, produce more complex sentences using compound words.
What we want to see him do is start building compound sentences and not just stick to simple sentences because he speaks in compound sentences.
His writing looks great. I mean, he's doing a good job. but it is tiring for him. And my goals for next year, we have been working on typing. We're working on him being able to form small words without looking at the keyboard.
I give him a lot of credit because it took a lot of patience on his part to be able to negotiate his really, really strong comprehension skills and yet his very weak phonology, and to be willing to trust in us that we were providing him with the right strategies that would, in the end, and I have confidence in this, make him a strong reader.
The revised IEP being reviewed today will lay out accommodations, specific services, and supports tailored to Sean's needs. The IEP will also describe Sean's current performance, measurable goals, and how much of Sean's education will take place with children with disabilities. Parents must consent to the plan before it's implemented. Then all of the IEP team members can work together to help Sean reach the highest possible goals in the months ahead.
Okay. All right, I thought I skipped over a slide there for a sec. So hopefully that kind of gives you a feel for what an IEP meeting might look like. As they mentioned on the video, those by law, a meeting where you're revising goals and such has to happen once a year at minimum. It can happen more often than that. In addition, there's quarterly reports that are provided that tell you progress on IEP goals. And as I mentioned in the video, parents consent to the plan before it's implemented. So, when there's questions or clarification or things that people are really thinking about in terms of what needs to go in the plan, that oftentimes can be an ongoing conversation until the plan is how people want it. Okay. And when we think about those goal areas and what makes a good IEP goal, it's going to be something where it takes into account current skills. So there's some sort of measurement of how the child is doing currently on a skill. It's going to be something that's can be completed within a 12-month period, but it's going to be, a little bit challenging. So it's not going to be completed necessarily right away. It's going to be meaningful, measurable, can be monitored, and useful to making further decisions down the line. For each goal, it has to be stated in a way where you can tell the conditions of when the behavior or how the behavior will be performed. What is that target behavior? They were talking a lot about reading on this example one, but it can be other areas as well, which we'll get into. And then the criterion. So like, what's an acceptable level of performance of that behavior? Oftentimes it's not, it doesn't have to be 100% of the time. You can think of situations where it should be 100% of the time because, if there's a dangerous behavior or something, like that makes sense. But other things, maybe we're looking at more like, 75 or 80% of the time in terms of acceptable performance. And the goals also has to list who is responsible for providing the services for the goal. So for example, a speech language pathologist for a communication goal, a special education teacher for a learning goal. So many kids with IEPs have those academic achievement goals, like a reading goal or math goal. And also a lot of kids have speech language needs and with those communication goals. Okay. But IEP teams should also consider what other goal areas may be appropriate. And they specifically speak to this in IDEA. Okay, so what they say is the purpose of special education is to ensure that all children with disabilities have the ability, or sorry, have available to them a free appropriate public education that emphasizes special education and related services designed to meet their unique needs and prepare them for further education, employment, and independent living. So if you think of that last part of that sentence, that encompasses a lot of potential areas to target, behaviors to target, and goals that can be written. And if an IEP team is thinking about a new goal area for a child, it's not, if the IEP is already established, it's not nearly the same long process as it is to initially determine IEP eligibility. So I think I failed to say this before, but when they do that initial determination of whether a child is eligible for an IEP or not, that can take up to 60 calendar days. Adding a new goal area is not that long a process. However, they probably do want to collect some baseline data because, as I just mentioned, that's important for thinking about how to write the goal. So some additional goal areas beyond just academics and communication include behavior, social, adaptive functioning, so like self-care skills, and motor skills. Okay, so with these goals, there's typically services, interventions that are going on and that are documented in IEP so that you know what's being used the individual for them to accomplish their goals. And generic names are oftentimes employed rather than like brand names. And in fact, sometimes you will see a brand name in an IEP, but technically they're supposed to all be generic names in there. So, when I was talking about a lot of the interventions, I was kind of oscillating back and forth between generic names and brand names, but you'll see it written more generically in IEPs. So you might see structured teaching instead of teach, or social narratives rather than social stories. Okay, so it's going to be kind of that category of intervention rather than the name of a specific intervention. An IEP will also document who's delivering the interventions, like I said, as well as how often they're doing it and at what intensity and what frequency. Interventions also can include assistive technology or other instructional tools, adaptations to settings, in addition to the teaching techniques, in addition to kind of the interventions. There's these things go in there as well as interventions. And all members of the IEP team should be thinking about what's evidence-based. And if they don't know the answer as to whether something is evidence-based or not, should be asking that question and finding that out as part of the IEP revision or writing process. So I just want to remind everyone of that. And, this is a huge chart, and it's meant to be big and confusing here. So I just wanted to let you know, like, this kind of information is available. So this is actually from that University of North Carolina website that I was talking about 2 webinars ago that talks about what is evidence-based. So you can see here, this is a chart they created where they talk about the practice in its generic name. I think most, if not all of the time. And then what ages it's evidence-based for and how it would fit with various areas that could be goal areas. Okay, so it's definitely okay for IEP team members, including parents and caregivers, to ask questions about the evidence base for a proposed intervention. The other thing I wanted to mention is it's also okay for a parent to invite someone to an IEP meeting. The school we'll need that information. Whoever's coordinating the meeting will need that information because that all has to get like put down on the IEP about who attended and stuff. But you can bring people to the IEP meeting as a parent. Okay. So now we're going to talk a little bit about accommodations and modifications. And these are typically included in an IEP. Accommodations can also be part of this 504 plan, which is separate from an IEP. If a child has an IEP, they're not going to have a separate 504 plan. Those accommodations that would go on a 504 plan will be incorporated into the IEP instead. So we'll watch a little bit here about accommodations and modifications, and then we'll talk about some for individuals with autism.
She will help row the boat.
For students with disabilities, the right accommodations and modifications can be as important to school success as appropriate IEP goals. These educational supports are similar, but they are not the same. Accommodations change how a student accesses information, participates in school activities, or demonstrates their learning. They do not change the curriculum. Modifications, however, change what is being taught or what a student is expected to learn and demonstrate.
I only need you to do the circled problems for me.
Accommodations can be made by adjusting the amount of work a student must complete, allowing extra time.
Just go ahead and turn your paper in. Okay, you can go ahead and keep working. You've got about 5 more minutes.
Adapting assignments.
Alex, I have your shapes here. Good.
Providing extra assistance, or changing the physical setting.
Let's do one more page today.
There is no one set list. Because each child is unique, the IEP team must identify specific strategies to help your child succeed. For example, presenting a few math problems at a time may help a student who is easily overwhelmed. Another student might benefit from short breaks, or being allowed to finish an assignment at home. A student who has difficulty writing may be allowed the use of a computer, while students with a print disability may benefit from having tests read aloud.
They went downtown.
A child can be given an appropriate role when working in small groups.
Where am I?
Or be allowed to participate in an activity in a different way.
Beware of what? Excuse me?
Being seated near the teacher helps some students stay focused.
So we'll go ahead and discuss these in a minute.
And assistive technology can support a wide range of needs.
And if you need me, you can raise your hand and I'll come and help you, all right?
In addition to accommodations, it is sometimes necessary to modify the curriculum. For example, when the class is learning how to tell time, one child might be expected to identify only the hours. While the class is working on vocabulary and spelling, another child may work from a shorter list or focus exclusively on the meaning of key words.
Insects with 8 legs.
Parents play a vital role in crafting the IEP. After all, no one knows your child better. So at home, watch for what works and any struggles that continue. Talk to your child about what feels right to him or to her. Make sure the IEP team considers your child's needs throughout the entire school day, including classroom time, non-academic and extracurricular activities, and transportation. You are not expected to have all the answers. Other members of the IEP team will have much to contribute. You can help by making sure that all accommodations and modifications are clearly written into the IEP. Be sure to ask whether any of the modifications will impact your child's graduation. Ask questions, offer ideas, and bring up any concerns you may have. Open dialogue and clear documentation are essential to developing a high-quality IEP.
When he gets to middle school.
I didn't know it was this far from the lockers to the buses.
During the IEP meeting, we can talk about adding extra time to Sam's schedule.
Oh, okay, great.
So we've talked about quite a few modifications today.
Hemos hablado acerca de muchas modificaciones.
¿Hay un límite?
She wants to know if there is a limit.
No, however, we do want to be careful if we create too many modifications, she may not be able to meet the high school graduation requirements.
No hay un límite.
Well, I know Tori likes being around other people, but she also has a hard time with conversation. So I was wondering, did you have, any other ideas that might help her with that?
Well, we could try a peer buddy, or we could work in small groups more often.
These are great goals, but Brooke's in the 6th grade and is only reading at a 2nd grade level.
This is true, but audiobooks should help her access to content better, and I think we might be able to find some textbooks that are at a lower reading level.
Tori always turns in her homework, but it's not always what was assigned.
Maybe if you can help her get started in class, she'll know she's on the right track.
Sure, I could do that.
I'm unclear who will follow up with each of these items.
I'll handle supports during basic instruction.
And I'll arrange for the seatbelt and keyboard.
Accommodations and modifications should change as your child's needs change.
All right, time for comprehension. If comprehension, then iPad. Are you ready?
Okay, guys.
You are not limited to a standard list.
Can we play?
So be creative and stay involved.
Could we go to the park?
I would love to go to the park, but you're going to study first, right?
Your child is counting on you.
Thanks for helping each other out. That'll be great.
Okay, so that gives you kind of a sense of accommodations and how they are different than modifications, hopefully. And just a word about modifications. So starting with the class of 2022, so this has been going on for a while now here in Iowa. Basically, with the federal law, Every Student Succeeds Act, it was no longer possible to award like a regular high school diploma based solely on IEP goal attainment. So the term regular high school diploma has to follow the state required standards. And if there is too much modification in the IEP, then it's not aligned with those state required standards. So that's where the discussion was kind of in the video about thinking about diploma or not, or I mean the regular high school diploma. And if you're interested in learning more about that, you can look on the Department of Education website. It'll take you to this publication on this. There's also a YouTube video explaining the change, which now has been in place for a while. It was kind of a big thing when it switched over, and now people are kind of more familiar with it. Okay, another thing that was kind of a big deal, and now people are more familiar with it, is strategies and resources to support learning at home, for children on the autism spectrum specifically. And so during the early days of the pandemic, we thought a lot about this. And fortunately, we had some experts in the state who were willing to put together some information for us and then update it in 2021 as well. So Jan Turbis and Sue Asklin created a webinar that I think is really still very useful. And even if you don't have a student learning at home, for setting up space and procedures for doing homework, or other study activities, you're going to find a lot of nice gems in their presentation. Okay. So thinking a little bit more about accommodations, the other way they can be provided is through a 504 plan. So not all children with some children with autism are not going to qualify for an IEP. Not everyone qualifies for an IEP, even if they have a clinical diagnosis of autism spectrum disorder. But these children may still be able to receive school-based accommodations in public schools through a 504 plan, which is part of Americans with Disabilities Act law, not IDEA. And the procedure is a little bit different. So rather than going through the AEA, the eligibility determinations are made by the school district. And they're within schools, there'll be a building level coordinator and then a district coordinator for 504 plans. And the general guidance for who is eligible is individuals with a disability that creates a substantial limitation and a major life activity. And there's been kind of question over time, court cases and stuff where they've like, okay, what is a major life activity and what's not? One thing I think is important for people to recognize is that concentration is considered a major life activity. Children with ADHD should be considered with this in mind. And many kids with autism also have an ADHD diagnosis. So that's why I bring that up. Okay, with a 504 plan, there's no goals, there's no interventions. It's a very short document just outlining the accommodations. And it's reviewed annually at a minimum. It can be reviewed more often than that as needed. Oftentimes there's about, it really varies by students, but maybe a very long accommodation plan, a very long 504 plan would have like maybe 8 or so accommodations listed. That would be on the long side. Usually around 6 or so is what I see more frequently. But I don't think there's any hard and fast rules about how many accommodations you can have. Okay, some examples. Consistent routines and rules, consistent places for materials and where to turn assignments in, some visual guidance on classroom schedule, using clear language to explain directions or what kids need to know. Sometimes with, again, more visuals, so visual or written instructions being provided in addition to verbal instructions. Preferential seating, I think you saw that one on the video. And also quiet environment was on the video where it's less distractions. Oh, cue the helicopter that's just going by my window right now as a distraction in the path of the life flight. Okay. And extended time for work if needed, verbal instructions repeated without any penalty, individual assistance when needed. These are all very common accommodations. Monitoring work pace and product, making sure kids understand by directing questions towards them, and immediate feedback on performance. Lots of positive reinforcement for effort and productivity. All of these things I commonly see on 504 plans and are in many cases appropriate accommodations for students with autism. Okay, now we're going to talk about a few resources out there for more information or that may be able to assist you or provide you with additional guidance. So first is the Iowa Department of Education website. And it has a page specific for autism spectrum disorder and some very nice resources up on that page. Secondly, those area education agencies that I told you about, those 9 regions of the state, oftentimes have specialists who have kind of like a special expertise or skill and are oftentimes part of resource teams. So rather than kind of go out to the same schools or same school districts week after week, They provide some more specialized consultation to many districts. And all of the AEAs have staff who have specialized training in autism who are oftentimes a part of these resource teams. So they can go out and help teachers and school staff with how to do their programming. They can work with the parents and school teams for assessment and developing intervention plans. They can be a part of IEP meetings. They can provide training to district and school staff. And they oftentimes educate family members and also students about autism. So one of their jobs is if a parent wants classmates to have information about autism, they can go in and do a presentation on autism in a class for a request of the parent. Okay. Child doesn't have to have a formal clinical diagnosis of autism spectrum disorder to receive services from an autism resource team or specialist within the AEA that's working with autism. And so teams are working with children who have been diagnosed as well as children who just have autism-like characteristics. So each has its own team. Sometimes they're blended with other teams, sometimes like the behavior and autism team or a blended team. There's a few school districts out there that have in-house autism specialists, usually bigger districts with more resource, and there's not too many of them, but there's a few. And resource teams are typically not involved with the diagnostic process, so it's separate from that clinical process. For a while, we had a partnership going on in Southwest Iowa, but I think that has ended now. And so they're typically not involved. Okay. This is a program called Family and Educator Partnership. It's had different names over time, but that's the current name. And the idea is this group of individuals employed by the AEA work as kind of liaisons between education folks and parents, and are able to get you information, are able to answer questions about processes, and help you prepare for an IEP meeting, get you information on transitions, all of those things. So they're kind of like they're part of the AEA, but they're somewhat an independent entity from the IEP team and the IEP process, and can get you information. There's also a nonprofit in Iowa called Ask Resource that is totally independent of the AEA and schools. So they're a resource center that can get you lots of information about special education law and many other things. But I think they're very good at being able to to provide information to parents and their caregivers about the law and track down information for families. Have a great website too. Okay, and if you have to be joining from somewhere besides Iowa and are thinking like, gosh, you were talking a lot about Iowa services today. Here are some places you can start to find information about educational programming in your own state. So either through federal Department of Education or the interagency coordinating through HHS federally. Both have ways to get to the state information. Autism Society, used to be called Autism Society of America, now just called Autism Society, has great information at the state level, and also Family Voices. All right. So let me put up my email just in case you think of something later on or want to ask me something offline.
Well, thank you. If anybody has any questions, feel free to put them in the Q&A box, and we have a few more minutes to answer those. There's a question, could you say those resources again?
Oh yeah, let me put them back up again too. So the first one, I should have labeled these better on this slide, but the first one is the Department of Education, the Federal Department of Education, that will has a map or a listing of all of the state Department of Education websites. Second is Autism Society, formerly known as Autism Society of America, have a similar kind of thing where you can click through to your local state affiliate of the Autism Society. And most of those states affiliate have a wealth of information on their website about what's going on in their state. Iowa is a very active state affiliate and has lots of information for Iowa. Family Voices is another national nonprofit that has a lot of information. I know they've recently provided lots of good information to families in Illinois that have information about autism spectrum disorder. And then the last one is part of Health and Human Services federally, and provides you with some information on at the state level what's going on for individuals with disabilities.
And I'll send these links out to everyone later on this afternoon, so you'll have them. There is another question that says, what does it look like when a kid is getting special education services in school? Is it an integrated classroom or a separate classroom or taken out of the classroom?
All of the above. So it's really based on the individual's needs. However, IDEA dictates that you should be serving the child in the least restrictive environment. So if it is a service that can be delivered in a general education classroom, that's where it should be delivered. If it's something where you need like a resource classroom with a special education teacher, then, then the child is leaving the general education setting for a portion of their day to get instruction there. And certainly, in terms of thinking about kind of severity and level of need, there are kids who are primarily or totally served in special education classrooms, like in a self-contained setting, where they're receiving the bulk of their school day in that setting. And things can change, I should just say too, like as the IEP goals are met, as behavior challenges resolve, kids can go from self-contained settings to a different setting across the course of their educational career.
Well, I'm not seeing any other questions in the chat. So thank you to everyone for joining us for this webinar series, and thank you to Dr. Pelzel. I will be sending the links out to all the recorded sessions and resources to your emails, so keep an eye out for that. But I hope you all have a wonderful rest of your day.
Thank you. Bye-bye, everyone.